This is the video for an ultrasound for acute bicipital tendinitis. So we're going to be working on the distal tendon here. So ultrasound is appropriate because the goal is to promote healing of the tendon, and the ultrasound will help bring blood flow to the area as well as increase macrophage responsiveness. So the first thing we're going to do is assess the precautions and contraindications for our patient. So have you had any surgery on your elbow or around here? No. Okay, so with that, since she hasn't had surgery, she won't have any joint cement or plastic components in the area. Do you have a pacemaker?
No.
Okay. And then other precautions. So you're going to look for impaired sensation, impaired circulation, impaired mentation, and then fractures, which she doesn't have, or epiphyseal plates, and since she is done growing, we're good there. So the next thing you're going to do is just assess the skin, and it appears normal. So then you're going to turn on the ultrasound machine, and well, I guess before that you're going to, so this is our ultrasound head, and you're going to clean it with an alcohol wipe so that you're not, you're decreasing the risk for infection. And then this is our ultrasound gel, it's the medium we're going to use, so wiping that off as well to decrease the risk of infection. So then you're going to turn on the machine, and for this we want a frequency of 3 megahertz because it's superficial, and then we want an intensity of 0.8, and we're going for a non-thermal effect, so we want a 20% duty cycle, so it's going to be pulsed. And then the treatment time can be 5 to 10 minutes. We're going to do 8 minutes because this is the first session, so we want to start a little on the lower end. So the first thing that you do after wiping everything down, selecting the parameters, you're going to put the gel medium on the patient, so it's in the area. And then after you've selected all the parameters that we said, you're going to move the ultrasound head around the area. You want to make sure that the ultrasound head is continuously moving so you don't burn your patient. Anything else? Patient position, so you just want them in a nice, relaxed, comfortable position, maybe with a little bit of lengthening of the biceps going on. So once you're done with the treatment, after it's been 8 minutes, you turn off the machine, and then you can wipe the gel off of your patient. And then did you have any problems with that treatment? No? Okay, and then you would assess the skin again, and everything appears to be good. So then you would wipe down the ultrasound again and the gel. And then other interventions that can be used are diathermy.